personally and professionally. And you guys can kick that off however you want.
And Ronda then started the coughing spree. I think the reason, and excuse me if I don't like remember everything you said because my brain's a little tired today, but I think why it's, education is important, and I kind of like do that in my day to day with my position and providing that around Louisville in all spaces, sexual health education is very important because you think that we at a place where people understand and know about HIV and AIDS and prevention and what's out there and what's not, and you'll be surprised that it's not that. You know, we still need to have those spaces where we provide an education, especially in those black and brown communities where we think, you know, we have it or we know it, and it still, you know, is a problem in the stigma. And my thing for stigma is, you know, it's not always like really loud and you know whatever. It's mostly that silence that we have in those spaces. We're not having it at. You know what I mean? So I think for me it matters in my professional or personal is because there's a lack of still in the communities and you know it needs. We're still having an increase in rise of HIV or whatever in Louisville and globally. You know, so yes.
Mm, thank you.
Mm-hmm.
I'll start with the personal. I have, when I first came to this in the 90s, did I just age myself? But yeah, I was very naive. I had a lot of those stigmas, but just because what you see in the community on TV about HIV, but coming to it kind of by accident, working in the Baltimore City Health Department, being kind of thrust into the like a community council, that like a cab, and working with people positive who kind of took me under and said, hey, here is an opportunity for you to learn and listen, and I did. Getting to know people who were positive really close and then losing some of them, and then learning that they had family members who were also positive and losing them, it made it real. Understand, you know, changing my mindset on how it impacted people, how I could potentially be impacted, really grew me. And that's the same way I evolved around, you know, queerness and what that meant, being as most of us grow up or have grown up in religious spaces, how you evolve your knowledge and what all of that means. I evolved across the board. And so that impacted me, and it's important for people to be educated, knowing how education changes everything. Ignorance causes all of that stigma. And professionally, I have seen it change, get people understand, especially in the black community, that idea in the black faith community, largely thinking that just because you're in a committed relationship, you don't have to worry, not being factual. That education about self-protection, self-preservation make a big difference, and especially for black women, and knowing the population difference between women and men, how important that is to make sure you're taking care of yourself. It's about self-safety and healthiness, not treating someone different. That's important for me.
I love where this conversation is going, and I want, as you grab the mic, Renata, you can jump in on this one. It's naturally kind of organically going into stigma, misconceptions. So I'm gonna jump to that question here. It's the one on misconceptions. Yes, thank you. What are some common misconceptions about HIV and AIDS, especially in black and faith-based communities, especially since that's kind of organically where we're going? And Renata, I know you were about to add something, but add in.
Yeah, I was getting ready to piggyback on something that she said about just black women in those spaces and the difference between male and female and black women, you know, holding some of the highest rates of HIV. And it's not because black women are more sexually active, just we are, you know, we have that prevalence in our communities more and greater, so we exposed to things at a higher rate. I was going to say that, but some of those misperceptions is some of those old ones, you know, just like if you are positive, then you wasn't living correctly or the right way and stuff like that, and that's, you know, not true at all.
Promiscuity and all of that.
I feel like HIV, as well as substance use disorder, is viewed they're not looking at those two things as the public health issue. They look at it more as a moral issue. And some people that have closed minds, well, that's what you get for injecting. That's what you get for being a homosexual or gay or whatever. To speak to what you were saying earlier, there was a time I never would have stood on a platform and talked about this. And so when I decided to accept a position at a different agency, well, it took me a minute to agree to it because I thought, why do I want to think about that? I had so much shame built into the fact that I knew I was positive. And, during my era, there was a lot of shame. I felt dirty and I felt like no one's going to want me or be around me. As a trans woman, I have always dealt with feeling accepted and wanted by, people, especially in a relationship. And then whenever I found out I was positive, I said, no one's really going to want me now. But to get to the fact, it helped me be able to let the ball and chain off and feel free and strip away all the shame. But for me, going out there, going outreach, trying to educate my brothers, African American brothers and sisters, cisgendered, I find that there's a lot of, as you say, misconceptions and ignorance because they don't know. I used to go doing outreach, and I remember approaching this African American guy, and it was an event, and he says, "No, I'm not going to get tested. I'm going to write off what my girlfriend's test is," and things like that. I think that they have misconceptions on how it's transmitted. Some think that you still can be infected by eating or drinking after someone. They don't understand that it's blood-to-blood contact. And again, going back, my experiences, my African American community just has this moral thing. And I think they think it's a queer disease, and it's they're exempt from it. They don't seem to realize that if they're practicing unhealthy sexual behaviors, they can also be affected as well.
Well, and you know what? I'm gonna say this. I'm gonna throw this in there and see how y'all play with this. Well, why not? We didn't just wake up and decide, you know what? I'm gonna treat people who I know are HIV positive as if they're nasty, dirty, or anything else. There's a responsibility here, right? Like there's messaging. If I constantly see images of gay men anytime I'm looking for medication or information, if I'm constantly seeing a visual of what I should be concerned about, promiscuity, over-sexualization, then why not? Why not? Why would the public think anything different?
See, that's a big piece of what my work is, and my passion is in that education and changing the narrative, because not just for adults but for young people, because one side of faith or just the general community is abstinence, no talking, don't educate, hush, hush, hush. But that is ineffective. We all know that. Even thinking to our own experience, if we're 100% realistic, curiosity is always going to be present. Young people are always going to ask themselves questions about sexuality and identity and all of these things. And if we don't talk to them as informed adults, they're going to ask the most ill-informed individuals who may take advantage of them. So my work is educate them the safe way, the healthy way, and how to protect themselves from these things. Not just HIV, and not, because right now the messaging, you're right, does vilify and does lean to stigmatization. My goal is to educate Black and brown people, especially first, and women far more, especially Black women, about our vulnerabilities. And there's a whole campaign about risk, changing the narrative from risk to reasons. Your reason for why you need to protect yourself. Your reason for why it's important to live a healthy lifestyle. And whether you are sexually active or not, what are your reasons for needing to seek prevention options, or whatever things, whether it's not just about birth control, it's about, might you have a sexual partner? Do you know your partner's status or not? If you do not, then these are reasons that you might want to talk to your doctor about whatever options you have for yourself on a prevention side. But if you are a positive person and you want to have children, these are other reasons. All of these kind of questions, and that narrative changes. This is not about being a queer person or a gay male or a trans female or a trans male. This is about safety, healthy living.
And I agree with that. I think one of the most powerful things I think I heard was from a conference I think me and you went to in Georgia, and a young woman said, you can't test out of an epidemic, but you can provide education. And I think that resonated with me. You know what I'm saying? The way I do my work today is knowing that the biggest goal and outcomes is really providing the testing or prevention, education, something like that. And also just want to say that, you know, as African Americans, we might die at a higher rate in HIV from late detection, lack of knowledge, education, whatever, but we don't conceive it at a greater rate. You know what I mean? I think it always look like for you saying it's always those pictures of African American or whatever. You know what I'm saying? Just portraying whatever face. But as for Black people, you know what I'm saying? We do, you know, die of it for late detection, like a lot of other things, chronic illnesses and stuff like that. But we don't contract it at the higher rate. That's why I put that up.
Thank you.
And one other thing, some of the issues around that, to the point of the potential to die from it, is also social determinant issues, barriers that exist. Like for instance, we all know money. People don't have good jobs. People don't have health insurance. People have other things going on in the community that challenge them, that cause fear and stress and gun violence and food deserts, and that becomes more a priority than going to the doctors. Like even myself as a young mom back in the day, I ain't young now, but back in the day when you had to worry about how you're going to get the kids back and forth to school, whether you were going to have daycare provider or getting them to their doctor's appointments, you didn't prioritize the aches and pains and the back problems and whatever else you had going on. You could be an HIV positive person. Are you going to continue your treatment versus taking your kids to whatever else they had to do? Or your mom, you got to help take care of your dad or whoever else. That stuff is going to become priority. And so these are all important factors that many, even medical providers, don't quite grasp. And so then there's that other layer of educating the providers that are serving you, that also sometimes turn their noses up when they don't get why you missed a dose, why you aren't getting treatment, why you're coming back, and they start to judge, think you're drug seeking and all this other kind of things. So these are all the kind of things that I'm constantly working on, and now you can't officially on a certain level say cultural humility. We can't use those words, but I use them anyway.
Yeah, y'all can't in them systems.
Yeah.
I do.
But yeah, I use them anyway, but officially these are off of federal lanes, but I say
'Cause
them
they don't
covertly.
understand.
But these still exist. It's important to still educate at these levels, because once you change how people see you, then it becomes a different frame and how they take care of you.
I agree.
Yeah, I think that's a. Go ahead, Rhonda. Go ahead.
What you were talking about, those social determinants of health, and that's one of my big things, especially when I was working in HIV services, the houseless community, whether it be heterosexual or you know, or the queer community, you know, how are you going to really manage your health if you have nowhere to lay your head? Where are you going to keep your medicines at? And, you know, surviving is their biggest priority. You know, and that's what really bothers me a lot is, you know, I remember an instance when I was working for this other agency, and one of my colleagues had tested a houseless trans woman, and wanted me, we were trying to link her into care, and wanted me to come along. They thought that, you know, someone looking like her would resonate better with. And so when we got her to House of Ruth, I believe, that's the first thing I started trying to work on, is trying to get her placed somewhere. You know, I'm like, if she didn't have anywhere to live, how is she gonna focus on the rest? And it just wore me out. I spent a whole day trying to get her house and was unsuccessful with it. And, you know, it just broke my heart having to drop her back off at this, you know, under the underpath downtown. And, you know, to this day, I don't know whether she ever got the help that she needed to be able to get healthy or not. You know, and I just wish there was some way that we could plug into that community better.
Yeah, I agree. I think I have that same sentiment with you guys. I think it's very frustrating, and it did lean right into that next question. But it wasn't so much. I think we're aware of how these factors like poverty, housing, lack of housing, housing instability, and limited health care is. I do wholly and think that it is, like, without me knowing the data, but it's 90% the healthcare folks. Just from my own experiences, you know, I have all of the things that, as a 46-year-old black woman, you know, you make sure I have my, what's the thing, you know, you mail your poop in now, right? You don't have to do the whole colon. Yeah, it was a very big brain. I had to really have a paradigm shift over that. But, you know, checking our colon, right? You know, getting your mammogram. I'm also single, and I like to mingle. Like, you know what I'm saying? Like, so single. When we look at statistics for STDs, period, who's up there, right, Caprice? Like, who's up there? You're talking about single women. You're talking about, and it's not an attack. I mean, we have one of our celebrities who announced being on PrEP, and she got attacked from so many ends. Like, this is amazing. Yeah. She's on PrEP because she is aware, fully aware of her behavior, and not in a shaming way. I mean, we in sexual liberation anyway, but it's funny when we start talking about prevention and sexual liberation. It's like, I'm sexually liberated. Here I am about to take care of my health, and it's like, oh, wait a minute, you that liberated? It's like, whoa, I didn't know it. But in our healthcare spaces, me bringing it up to my doctors, like, yeah, you know, I think I should have get my STDs, you know, get my little panel done and get an HIV test. Well, you know, you're seeing a woman now. Oh, I didn't know you had a say-so over what I'm concerned about. Well, oh, you're doing this. Oh, you're not this. When I was married, oh, you're married. You obviously ain't reading nothing from the CDC, because these are things that the CDC has reported out with the data from the work that you all do. So I don't know if it's the factors of this other than, like, healthcare access. I even think in the East End, when I saw a doctor, they were just as insecure or had trepidation on how to gauge this conversation around sex, around sexuality.
I think it's all of those things. I think it's the individuals not seeing themselves, like, in the advertisements. Like, you know, by and large, it's mostly the standard, so to speak, where it's mostly men, or it looks like gay men, or it's not looking like women at all. Or you go to your provider, whether you're a male or female. And if you are a male, like, for instance, at the last PrEP conference, one of the providers even, who said he went to his own doctor and said, hey, I'm ready to get on PrEP. And he was like, why? You're healthy. What do you need that for? And it's not the doctor's position or his job to question. If you come in and say, I want this, I'm interested, it should be the provider's response to say, okay, let's find out what your health indicators are. What's going on with you? Do you even physically qualify for it? Because, you know, you could have something going on with your health that prevents you from having this particular type of PrEP medication, which there are now for, but still, it's not his to question why you want it. It should make sure you're be good. Oh, I'm glad to hear that you're, you know, looking out for yourself. Let's check, make sure you're good. That'd be the same as if, hey, I'm worried about my diabetes. Can you check me? And he goes, why? You know, what do you want that for? Oh, I've been having headaches. I want to check that out. Why? You know, you look fine to me. that would be nonsense.
Right.
And so we should treat all of these concerns that you have with yourself as you can push back. But and that's plus my research too, and my push. And you all have participated in that too, especially for women education. Women have not been taught to be autonomous, especially with sexuality. We mostly have been there to be servants in a way, and I'm not to be crass, but it's true, where we're not allowed to talk openly about pleasure or anything of that sort. And so that makes it hard to speak up, to say, well, I like to prevent myself from having this worry, this concern, here's my fear, so that when you go to your doctor, you will talk back. People, or Black community as a whole, does not talk much about being worried about doctors being wrong. My dad even is
Got
a
a
very
question.
old school talk. Trust what your doctor said. He's educated. He knows. We've got to learn to push back. And so we've created a booklet that even is about that, having you be able to take your notes, go in prepared for your doctor, or even we create a list of questions that say, challenge your doctor. Ask about the medication that they're prescribing for you to make sure you understand.
Yep.
All of those kinds of things. So that is the mission, and I think that's part of the standard. Teach yourself, educate the providers, educate the community. That's why I said it's at 3 levels.
Yeah.
Which are barriers. We have barriers that are external and internal, and those healthcare providers are really, really horrible at that as well. So I see that all the time as well. So, but it just amazes me how we don't like to discuss about how we got here. We got here by sex. You know what I mean? So the uncomfortability about sex is real, and it boggles my mind sometimes when I'm doing any kind of education or doing anything out and about in a lot of spaces. So just that's how we got here. Like, why are we not comfortable about protecting ourselves about it or around it, anything like that? So, yeah,
For working in this field, you have to be sex positive.
definitely.
And I definitely am. I kind of have a question. So, do you feel, what is your differences when you're trying to educate the millennial generation versus my generation baby? Because my experience has been, like, they're just really hard to reach, and they have all the old ideals, and they're not open to learning more about it. Or I feel like that I've always been able to reach the younger generation. They're more accepting, more willing to get tested. That's just been my experience.
It's true that it's different to get them in the room, but once people are in the room, I think it's kind of the same. You know what I mean? People are reluctant to come in the room because of the old ideas that we just talked about, because of what we as women and men who grew up in the church, or we grew up in certain communities where you didn't either had to dress a certain way in the public, you had to present a certain way in the public, but then you get in a space. That's why I've always tried to create certain, it felt safe spaces when we do outreach and stuff. So I'll hopefully encourage people to start blabbing however they feel, whatever they've been thinking, without judgment. Because everybody feels the same thing. And we do events with all ages to try to, and you've seen young people start speaking up, older people start speaking up. We have people disclose status because it feels comfortable to do so. So that is the goal. We've got to crack the nuts sometimes to get both people, younger people, older people in the room. But once they're there, it's usually kind of the same.
Which is a must because the younger generation and the older generation holds the highest of STIs globally. So
It's amazing to me right now how many elderly people, including people that are in long-term care, was coming up with all these STDs and things like that. But, I guess during my training years ago, sex is the last thing that leaves a person, no matter how old you are.
Yeah.
As long as you're still cognitive, you think about your appearance, and that desire for sex never leaves.
And I think that's just been a common thing, especially in the U.S. When we're looking at over the years. I remember watching. I always think about that episode in what was it, ER? Remember ER, the show? When they went to, it was a couple of nursing home residents went in the ER, and they both had the same sexually transmitted disease. I think it was gonorrhea or chlamydia. It was one of those. And they were just kind of shocked. And a lot of the nursing home residents had the same one and found out that they were having sex. And it was like, what did y'all think? That people just stopped having sex? So I think, and that was what, the 90s? And we since then have seen different movies, different shows that show the same thing. And the only reason they continue to show it is because stigma still exists. And stigma plays a very heavy part, I think, in what we see in legislation, what we see in the policies that are pushed, what we've seen in the cuts in HIV this year. A lot of it is ignorance and stigma, but I always say how we combat stigma, because if stigma thrives in silence and ignorance, transparency, and awareness, right, being authentic, showing up with your truth, and being a person with lived experience, speaking on things will combat that and remove that shame. As we close out that first segment, and I'll circle back later as we close out both of this entire discussion for one of those rapid fire questions up there that I think would marry well with the end. But I want to move into stigma. Renata saying stigma can be silent, and stigma silence in the church. I like how that's put, because there's so much silence in the church. It's like a pin can drop, and you would hear it. I know, Caprice, I wrote down, you're talking about how you got into the field by way of public health, but the early on of you holding your own stigma, right? Your own thoughts. But what broke that was being involved, being thrusted in this work, and being pulled into relationship and community with folks who can show you that it's like almost like having the assumptions shot down one by one, right? And ignorance causes stigma. I wrote that down, and Rhonda, definitely that shaming place, the self-shaming. I talk a lot with people about our self-oppression. You know, that was a concept that actually was brought into my life from my psychiatrist, who talked to me a lot about things I would say about myself, and talked about the concept of self-oppression. When you grow up as an oppressed people, we more likely take on those same oppressed thoughts, feelings, observations on ourselves, and we oppress ourselves, right? So keep ourselves from being in front, keep ourselves from standing up, speaking up. It's taking on the stigma. So if either one of you guys want to share on this one, because I want to get a couple of these questions out. In your experience, what does stigma in HIV and AIDS really look like today? And where is it most often seen? So I don't want to think about the years. I want y'all to chop your years down to right now, in this moment. What does it look like?
I can say what it's doing right now for me. It's a barrier for the outreach and engagement. It's causing a problem, like even directly infecting my research, population-specific research. That is important. It's causing people to pull back and being seen, like populations who were once more open to participate and be tested and come out and be, who they are and be themselves. They're less willing. Because of that stigma, because like even, with this whole ICE thing and this sort of, would you crack down on queerness or even blackness or anythingness, is causing so much stigma around this. Even the reduction in funds is an intentional attack on everybody's differences. And that is causing so much harm. That is stigmatizing that need, and people are leery of knowing their status in that way because it's othering folks again in a bad way. That's what I see but we're trying to still fight that effort. It's like with that same narrative I already spoke to.
Well, Rhonda, before you speak, I want you to speak on how have certain faith teachings or church cultures contributed to silence or stigma around HIV, sexuality, and identity?
Me or Ronaldo?
Rhonda. I'm glad about what you spoke, but again, I wanted, these questions are really good, and I want to get them in.
I was right there with you.
Yeah. I wanted to see if Rhonda could speak to how faith teachings or church cultures have contributed to silence or stigma around HIV, sexuality, and identity.
Well, it goes back to what I initially said about how people look at HIV and substance use disorder as a moral issue. And so I used to go to a different church that was a ordinary secular church, Baptist church. And so as I was, getting my feet wet working in HIV, I wanted to have a health fair. And, well, they had a health fair, and I wanted to include HIV testing. And I brought it up several times, and I would get told, we'll get back with you. And it's, and I never heard anything, It's like they hush, they didn't want to talk about it, as you said earlier. And I think the vibe I got is like they really don't realize that HIV and AIDS is something that anybody can get. I think they still think that it's a queer disease. And a lot of faith-based organizations feel that if you just be abstinent, you wouldn't be in that predicament to begin with, But let's face it, people are having sex, and even, our younger generation, teens, they're having sex. And if their parents are not teaching them or trying to get them the education they need regarding sexual health, then they're going to end up, in predicaments that they might not want to be in.
Okay.
And I just think that's kind of how the traditional church is built in kind of in their,
Okay. Before you answer, Renata, I'm gonna throw this question at you to add on to that. But hold on to that to add to. I know she's like, dang, stop doing that.
It's gonna be gone.
How can, no, it's not. It's gonna be there praying. How can you, hearing what both of them are talking about regarding stigma and where it comes from, what it looks like, especially when we're thinking about the church and the people, how can youth and family ministries play a role in HIV education? I'm picking on you too because you do a lot of work with youth. HIV education in ways that are age appropriate, culturally sensitive, and grounded in compassion.
Mouthful. So this, you know what I'm saying? I believe having these kind of like spaces, I know it's very big to speak about abstinence in churches, but look at other ways of approaches about sexual health with the youth population. It starts with the youth. I mean, I was a teen young mother at the age of good old 14, and I just know that it's a need. You're right, I do work with a lot of youth and adolescents in regards, and they know way more than I would ever think a youth adolescents would know, but then I knew it too as well. So I just think that, creating these spaces, having those conversations, even in the youth portion of teachings in church or whatever. And this is one of the questions also when I read it, because I'm not in church as much as I should be, how I grew up. So I will be honest about that. So when I seen the question, I was like, I was living for this moment also as well, because I think where we are today with the youth population or with a younger population in church or whatever we are today with social media, the whole thing, I want to know like what it looked like for church today as older, congregations kind of like move a little bit back to the back a little bit. Not saying they moving out the way, but it's a different look and a different vibe. We follow trends even in churches and stuff like that. So I kind of like want to know what that looked like in these spaces too with stigma. So I was living for this moment in reference to your questions and those answers. But I think having spaces like this, just coming together, and just allowing the youth be in the forefront in these conversations, these topics, because we can't have what they already know because they know. And if you don't teach them and they go out and learn from somebody else, then it's always the wrong way.
I got to piggyback on that because my passion work is, besides women, is adolescent health. And a lot of my early stuff was keen on kids, especially because I was a young mom also. And it was like, it feels like my thought process was, if we start with the young people, we can get them before they're adults and prevent a lot more. And we did a lot of work with, even here with the university and community partners, in educating young people, using them as peer educators, teaching them first, working with pediatric doctors to give them full education and using real terminology, not cutesy stuff. Real terminology, real learning, and helping also to train the pediatric doctors on how to treat them, how to understand how they identify, and instead of using adults pretending to be kids, and challenge them, the doctors, like, nah, you messed up, man. I don't like how you talk to me, and vice versa. And so they taught the young people the real technical names of every STIs and how you learn stuff, because before they were getting messages like, oh, if you use mayonnaise and mustard, mix that up, that'll cure this, that, all kinds of nonsensical things as safe practices. And so they were taking that out to community and educating each other. Is to the point that if you do real education, they educate each other better. They're not going to come talk to mom and dad. They're not going to they will talk to brothers and sisters, best friends, and community, and give them real good, healthy information. And because they won't trust you as adult, and they will lie to doctor a little bit, but if you be also, like I said, goes back to the point of educating everybody. And they use that, and they were so proud to come back when screenshotting without names, saying, look what I did this, and they listened to me. That they were improving things. And as you can even see from the data, teen pregnancies down, safer sex practices is up among youth, and STI prevalences are down. Education works. And so the state of Kentucky, though, however, is very challenging in that way. Like, we cannot provide PrEP, even though it's approved for 13 and up. Well, you can't give them until they're 18. So the state policy versus reality is out of line. And so we really need to work on that concept.
I always said that the state or the federal government has no business being behind the closed doors in a HIPAA compliant office space where doctors make decisions.
It really makes it very hard to save, people's health in that way when they don't line up with how it really works in the world. But
I'm going to say this about the church, and I mean it. The church is complicit, because if churches operated like the true businesses that they are, because they are, faith-based institutions, systems, religious systems is a part of each system. Like, I wish people would get that in their head. But if they operated like any other business and looked at where they see the people that they lead, like any business or organization, if you see that you have no one that can success you, so your succession plan ain't working because you don't have young people in there, then the church needs to take a look at itself in the mirror, because we're missing youth. So when we talk about what youth need in the church, first, we don't have youth in the church like we used to. When I grew up in the church, it was a bunch of us all the time. There was youth, but what happened was we got to a point where we got comfortable and we believed in opening up and sharing about our truth, and we got ridiculed and moralized by it, and it pushed us out the door. We got moralized because we wanted to smoke weed and didn't understand why it was such a bad thing when the parents of the church group folks was smoking in the basement, but they didn't talk about it, right? So that's the first thing, is the church has if you want to connect to the you're going to have to change up your manuscript, right? So that's always been a point of contention with me, because the youth are not even here. So when churches tell me they want to connect and I come in and I see you ain't got no youth, you've pushed them out the door. The next thing is real conversations around this. I think I have that same conversation in harm reduction. Any space I go into, if I go to a youth panel or I go to a youth discussion, I see people who were former youth, then you didn't do it right. And I make it clear and say you're not doing it right because they're not in the room, just like when I wasn't in the room and black people started showing up, right? Black people show up in spaces and help create the policies and changes. We need youth, but we can't do that when we don't open the door to allow them to speak authentically and not ridicule them for it.
And I, go ahead.
It's really been hard for me to get my mindset wrapped around, being positive in regards to that, because my experience, I'm 66 years old, so when I came along, no one told me anything about sex. What what experiences I had with sex with someone doing things to me. And then, I grew up in a little small church. I always worked in church growing up. But the moment that I started to transition into Rhonda, backs was turned. I was an outcast, and didn't feel welcome. I didn't, the way I was pushed away, you're gonna find acceptance somewhere. And so when everybody that I grew up with and knew and loved turned their backs, I went to the people that I was always taught not to be around. And was doing some of everything and being, participating in a lot of risky behavior. When it comes to substance use disorder, injecting years ago and sharing syringes and needles, all that stuff. Where I feel like that if I had been embraced and educated during that time, some of the things that I've had to endure wouldn't have happened.
Yeah.
See, fear as prevention is not prevention.
Right.
But I think that's what the larger community of faith does.
Right.
Whether it's about drugs or transitions or sexuality, that's what it's living on, and it's deteriorating the overall larger church network. If it just go back to what, the model was supposed to be on is love and be there for others and support and all that kind of thing, it might turn around, but it's not living that way right now.
Well, and not just fear. I think that, even the things that seem to be kind. I remember, I'm not sure who was with me. I want to say it was Rondo. You may remember this, but I remember someone was sharing about their status and they were negative, and someone said, praise God. And what it does to the person who's positive, it goes, so God didn't care about me? Like, it's our language, it's how we show up. We think, well, you're not you're not positive, so God protected you. That's actually something that people don't know. And we could talk about this. Listen, when we get together, we could talk about this all day and all night and have to just stop each other. So let me get back on track. But it's just that idea, and because we in the space where God shows up in some of our lives, I feel it's only right to throw this at God's, altar, to say, hey, this is what we're down here doing. So I want to ask this question as we start to wrap up. And it goes back to the top. If you had things that you just really want the community to know, because this is cool, people can come back and watch this. They usually do later on, another day in the week. They may find it at some point while they're streaming things. But they land on you. Say they land on you, and they land on that last part where it says, what is it something that you really want people to know in regards to HIV, AIDS, PrEP, you equals you, the whole everything? If there was something that you're like, you know what, I really need people to understand this. If I had a space and a mic, I would scream this out. Whatever that is. And this is a great question, I just reframed it. But what do you want people to know and understand in regards to all of those things, prevention, living with HIV, all those things? Whoever wants to go.
I feel like you can really go in on this.
Well, I want to say that get tested. Know what your status is. Don't think just because you're married with children and all that you're exempt. What if your partner's cheating on you and going out there and doing, having unprotected sex with You know, it could be with a female, it could be with another guy. You know, there are a lot of guys that are men that are on the down low. You know, get tested, know your status. And if you're not a person that does risky behavior, still get tested once a year. And then if you're a person that enjoys sex and has a lot of sex, and you know don't particularly maybe like using condoms, then you know look into getting on PrEP and test more frequently. I think just that type of education goes a long way.
Thank you.
I think so as well. Just, testing or knowing your status is really half the battle. Just, not being afraid, let people know that, what I'm saying, it's okay to know your status, okay to get tested. For the most part, it's really that. You know what I mean? People just really stay away from getting tested. They really fear getting tested. And it's just, it could be easy as a finger stick or finger prick or even get labs drawn or whatever the case might be. But I feel like, you can walk in your light a little more with purpose if you don't know your status and stuff like that. And then just, get tested for the most part of it.
There's a lot of people walking around probably positive that don't know it because they won't get tested.
Yeah.
And especially in taking it back to harm reduction and substance use disorder, we definitely don't push but encourage our participants to get tested for HIV as well as hepatitis C, because those are the two things that run parallel with each other in substance use disorder and people that are actively injecting.
So for HIV, for me, I'd say get educated. It's not, even if you don't feel you have a reason to get tested, make it as part of your standard testing panel. Like when you go to the doctor and they do your annual screenings for whatever you're getting screening for, and they ask you, accept that screening anyway. And it's not a judgment, it's not accusatory in saying that, oh, you're one of those people. HIV impacts everyone, regardless of income, regardless of age, gender identity, expression, or any of that. HIV can impact anyone. Get tested, as everyone has said. For prevention, it's, as I've said before, it's not changing the narrative from risk, because that can be stigmatizing language, to more reason. Understand your reason that you want to protect yourself and live a more healthy lifestyle. There are options. For women, there are at least 2 options, if my memory is working right now. But for men, there are 4 options. There are injectable options, so you don't have to go to the doctor as often for people with very busy lives and hectic situations. So educate yourself. Contact one of us. We will help you get educated more. We'll share information anytime you need it.
Get tested, know your status, get educated, make it a part of regular panel. I do that. That's mine annually. I love the risk, from risk to reasons. I like that language change. You equals you. Undetectable means untransmittable. Just for people who are not familiar with the language. Youth out there, my thing to youth, any youth is 24 and under, okay? I want you to hear me clearly. These churches saying they want you to come in, they want you to test, talk to them. I want you to test it. I want you to try them out. I want you to see if they capping, right? See if they really are real about what they're saying. Go in there and tell them how you're feeling, how you're showing up. My daughter did that at our previous church, and we collectively stopped attending. She had a moment where she shared honestly about something she was doing, and the response was not what she needed in that moment. And so try them to see if they're real. I have on my page, I had one of my former colleagues, I asked him, I begged him to actually film my testing scenario, and it's on my page. If you are kind of concerned about what that looks like, what it feels like. I was nervous. I'm always nervous every time I get tested, y'all. I don't care what I'm doing. It's just anxiety, okay? But you get a chance to watch the video of me being tested, what that feels like, the time it took, and when I got my test results. And it's all on my page. I post it every year, December 1st, because I want people to see it. But if you are struggling with the idea of going and you want someone to walk beside you, I'm one of those folks. You can inbox me. You can email me, and I'll connect you to these amazing women here. I don't do testing. That's not my lane. I don't know how to test and not go with you emotionally wherever you're at, but these folks right here do. I come in afterwards, but they can do that, okay?
Listen, when I first met you, we was testing you. I was with Marshall.
Yeah, that's right.
You did a laugh.
Marshall, I was in there almost in tears on the video, but because it's anxiety. I come from where we used to wait 2 weeks for the test results. That was terrifying. Okay, we are much further along than that. Okay,
It's minutes now.
yes. So I want to thank you guys for being in this space. I look forward to bringing you back next year, Fresh Fire. We are speaking to the spirits that will end up in here. We're speaking to the folks, the youth that will come because they did hear the call. We're speaking to the folks that are going to show up because what we need in our community is consistency. So our people are watching us to see when we're going to stop, to see what we're going to do next, if this is just for right now. But I'm here to tell you, we're going to keep going, okay? Because this is about God's work. It's about changing the narrative of what the church is supposed to do in the community. And next year, you guys, we're going to need more spaces. I'm calling on my faith-based spaces and saying, what y'all up to? We're holding each other accountable. What are you going to do? All right? Minister Emily Jackson, do you want to close out with prayer? Or how you want to do this? Thank you, ladies, so much for being a part of this conversation.
Oh, anybody have questions?
Oh, you have two. We have two questions. You have questions out here. I didn't know. Oh, let's go for it. He said, "Don't close yet."
So two of my questions were, there was a point where it was criminalized, where you could be sought after for sexual assault if you didn't disclose. And the second part of that question is, at what point would you start disclosing or out dating?
I
Say
didn't hear
that
the
second part.
Yeah.
Say that second part again.
At what point would you start disclosing status for people who are young and out dating? Is it you're going to go out on your first date or 15th date? Are you too far in, or should you set it up front?
So, I think individual decision to disclose your
Great
status
question.
is a personal decision. You're right. There are a lot of states that still criminalize HIV, and there's a lot
Yes,
of work that's being done to remove that very antiquated, outdated ideology from the books. I think Kentucky is still battling with that. I can't recall where it is. A lot of, the underlying things have already been removed, but it hasn't been fully removed.
Sex workers.
Yeah.
Sex workers are still able to be convicted.
Right. But that's because there's the idea of intentionality.
Right.
But I'll say at the same time, you have to really prove intention. You know what I mean? How can you? But I won't get into that too far. Because that's a slippery slope to talk too much about. But
can I add to the criminalization? There's a lot of work being done around decriminalizing HIV. The thing is, yes, before you can be prosecuted, they have to be able to prove intent. Mm-hmm. The harm right now, though, is you are exposing people's status publicly, and I've seen it twice in the news. Mm-hmm. They are permitted to expose. So HIPAA says, no, Sharita, you cannot disclose someone's status. Hospitals, doctors' offices all have these very strong HIPAA compliance regulations. But when it comes to law enforcement, that is where they throw HIPAA out, and you can be exposed to the court. The court will know. I think sex workers are tested automatically and put into a system once they are locked up. And don't quote me completely, but I'm hearing that actually from people who actually have been in these situations. You will be tested if they do not know your status, and if your status is positive, you are now on a list that if you were locked up for that same thing, your charges will continue to increase. And we're talking about moving towards felony, right? No matter if you're undetectable, no matter if you're using protection, but sex work specifically. Now, one-on-one with people, I've walked a lot of people through disclosure, and at what stage, disclosure matters. And that, I agree.
It's still individual.
It's very individual.
And medical providers cannot break HIPAA just
No.
because if someone, even if law enforcement came to ask, you can't break HIPAA
No.
unless they were, for some other purpose. Like, say, for instance, we have had family members ask for, I need my somebody's records. You can't just do that.
No.
So from our patients, we cannot do that just because even when someone has passed on, we don't just openly disclose.
No.
That HIPAA standard still bears on even after death.
Yeah.
So people don't have to worry about that fear of disclosure, at least from our service. Now, if someone else has this really loosey-goosey means of protecting that, I can't control some other service and how they manage, but we definitely adhere very strictly to protecting people's status and even however they identify. If they come in, how they come in, we're adhering to that, honoring pronouns and all of that.
Had clients or participants that I've tested, and they would test reactive, and they would talk to me and ask me, what should I do? Should I tell my partner? And I would always tell them, that's your decision to make. You don't have to share. I guess if you want to look at it from a moral point, you probably should tell your partner. But, you want to make sure that you're thinking it through clearly and making sure you're not creating an unsafe atmosphere for yourself. Because a lot of instances where you're exposed to a partner, they forgot. So yeah, I always tell my clients that I test, your decision when you decide to do it. And if you don't, then that's your choice.
Now, I don't know about this first date thing. This is just my opinion. This is not because think about you on a first date. You're at a coffee shop or something. And you're just gonna tell all your business.
That's the kind of conversation
that just feels unrealistic. just
presumptuous.
because it's HIV, I think people hold a very higher than usual standard for telling people things. But you're in a first date, very casual. You just open up your whole life. Now, granted, some people do that. But your average person is very casual, very getting to know you basic.
Right.
Let's be realistic, and that goes back to the destigmatization and not stop having extraordinary expectations on this. It's life. Yeah. Treat it like life. When you're going to tell somebody you have cancer, when you're going to tell somebody you have heart disease,
you want to be
or
married,
diabetes, think about when you might be ready to tell people something very heavy about you. When you want to get married, when you want to have. Think about when you start sharing that kind of really deep, heavy things with people. Then, maybe you might want to think about when you want to tell a partner. That's a real, in my mind, and this is not me giving broader my professional, this is me opinion.
I was going to say something to that effect, too, when it comes to disclosure. I agree. It's a funny conversation. When I was working at House of Ruth, part of my clinical work would be we would do role plays on disclosure. A lot of people who were newly diagnosed didn't know, they'd say, well, I want to tell my employer, and I didn't shut people down. I would ask, why? What is it in your work? And help them think about, is there a chance for me to expose someone at this level? And if you're working at McDonald's, there's no chance. But there is a chance for people to now stigmatize you. And that's a way to, that safety issue, what Rhonda's talking about, is a reality. She's not making something up. There have been situations
Yeah.
where people react very strongly and unnecessarily, but that's ignorance. When it comes to disclosure with HIV, that same kind of conversation would happen. So tell me why. Is this someone you're about to go sleep with right now? You want to have unprotected sex? And it was like, wait a minute, slow down. Okay, then you wait a minute, slow down. Why are we walking in here talking about this now? Right? Or I'll say the marriage thing. Someone's dating me and they want to tell me they want to get married, they want 5 kids. They on the first date, first of all, you going too much, too heavy. I don't even know if I want to see you tomorrow. Like, so it's taking these steps, these very intentional steps. Like, am I even gonna sleep with this person? Am I going to get that intimate with them? Is there a risk of me having a conversation first? And I'm gonna tell you, there's just a lot of lack of it's immaturity, it's a lack of knowledge. But I had a guy turn down a date because he saw that I was on the board for an organization called Kentuckiana AIDS Alliance, and I'll never forget the first question. Well, why? What's the K AIDS? I was like, oh, that's an organization that I do X, Y, Z. And I was like, so do you? He was like, oh, no, I don't know nothing about. I was like, oh, well, I don't want to know you. Because how dare you? You don't know nothing about this? Then we absolutely shouldn't be talking, right? There's so much stigma, so much ignorance. Honestly, it's pretty cool for me when I can walk into a room and be like, so let me tell me when you had your last HIV test. I say that on the first. I say it on the first date.
Me too.
Yes, I will, because I want to know. Because you about to go out the room and you say you never. And somebody might be on here like, man, Sharita, that's not fair. Yes, it is, because that's how serious I take it. I take health. When was the last time you had a colonoscopy? Sir, you are 45. Okay. I'm not taking care of someone who's about to get sick right now. Like, how's your heart doing? How's your cholesterol? Okay, is your A1C level? Like, that's where I'm at, because I'm 46. So just wanting to throw that piece. Renata, I think you were going to speak. Caprice, before we end, there's a question about information about the 550 clinic, when that is closed, when it opens back up, and all those things.
Okay, so right now we are on winter break,
I can't
but
stand it.
I love it. Ish. I'm never on break actually. Like I'm here working ish now.
I know.
But we are on winter break until January 5th. But if there are any urgent needs, individuals can call the clinic or go to our webpage and send a request. Those are being monitored, so if there's anything important, we can, you can get to me or any of our clinic manager who is monitoring clinical follow-ups, and for case management issues, if a voicemail is left, it comes to my inbox, and the senior team is monitoring those.
And we do not test during this time either, because the
doing
550 clinic is closed for 2 weeks. I want them to have a break, but I get sick of that. But yeah, we don't, because we have nowhere to refer our people. So.
The same. So her break is our break a little bit as well. But we use this time to just regroup and figure out how we're going to go into the next year. New sites, education, like strategies and stuff like that. So, but if you need to get a test, we don't turn nobody down if you walked in. Because why would we do that? I think Norton's also is one of the places you can go as well. But if it's time, like she said, we use that break to really regroup. But if you come in, you walk in, we're going to test you regardless, because we don't want nobody to walk out and could be a reactive or positive and then go through the holidays or whatever. But, yes.
But like I said, if there's an urgent case management need, say like if you had a walk-in test, we could probably coordinate at least to get you, some conversation, touch base during break. But ideally, January would be great.
If anybody is wanting a test, the health department is also testing during this season, with the exception of the days that were officially off for the holidays.
Any other questions out there? Any other? Okay.
Yes, ma'am.
I know that's right.
Yes, ma'am.
God is a God of all.
That's right.
Not the rich, not the middle class. He's the God of all. Not white, not black, not heterosexual or gay, because he created us all.
Yes, ma'am.
So when the church realizes really who God is, they'll take those youth in. Because you're right, any church that don't have no youth in it, something is wrong. And I'm like Rhonda, I'm 60-something years old, and let me tell you something. When I was going to church, you had to wear the long skirts, no red lipstick, which I love. And you couldn't look all diva-fied with your nails polished and stuff, but times have changed, and it is time for the church to do the same. Come down off your high horses. My name is Pamela. Come down off your high horses, and let's take these people in and love on them like God loves on us. Because where is your forgiveness? Because we all have to give an account. And let me say this, God knew they were going to Let's say that.
Oh, that's right.
Because of this omnipresent, so he knew. Let's have God say, thank you for letting me share that.
Oh, thank you. Such a beautiful closing. Go ahead.
As we close out, I will say we will see you all again. It was an event that we talked about wanting to do, and we was trying to find people that could do testing. It was in-house, so I think it was God ordained. So this partnership will continue.
That's right.
So I will want to thank you all for taking your time on a Sunday afternoon.
That's right.
To be a part of this discussion, because this is the need and the call of the church.
Yes.
It's two things I'm going to do. I'm not going to take up an offering, but it opportunity to give, because to do this work will be real. We need money. So for who's joining online, because we want to continue this work, and we need resources as well. So if it's a blessing to be a blessing,
Watch what magnesium does to your bowels.
If you have to wipe 1,000,000 times after you poop, here's why.
The Mayo Clinic.
email, website.
Work number 502-550-5624, or either send me an email at capital RHONDA period capital COWAN LOUKY.gov.
You can reach me, Renata Allen, and my email is RENATABOAMID.org, and maybe I can put it in the chat or put it somewhere out there. But if you know anybody who wants to be tested for HIV, who needs sexual health education, we come out to our Nick and crannies. We don't mind majority of the time nor the day. So if you're interested, please reach out to me.
Capric Walker, University of Louisville, Ryan White program. We do have a website. You search Ryan White in Louisville, it'll pop up. But my direct number is 502-852-3489. My email is C, like my first name, M as in Mary, walk 08 at louisville.edu.
So you have that contact. If you need to rewind and hear it again, you have that opportunity through the technology to do so. But we're going to pray this thing out. Father God, we just want to tell you thank you again for this conversation. God, we ask a special blessing upon these ladies, God, that you would touch and anoint them as they do this work, God, as systems are challenging, as funds is depleting, God, that we know how much important this work is done, that God, we know that you are a God that is able to take little and make much, that in this season that you'll still have an increase for the work that needs to be done. God, we pray for those who be joining on this live, those who are in the place, those who just got a diagnosis, those who are and worry about diagnosis, but God, that we know that you are able to do exceedingly and abundantly more than we could think or ask. So God, we ask that you will cover in your love and kindness, cover in your grace and mercy, that your blood is able to cover any and everything. God, that you will bless them for this season, that you will have a great and Merry Christmas. And we ask in this week that you set some things on fire. We see you next week at 2 p.m. Amen.
Amen.